Telehealth isn't new to Australia. We have a long history of using whatever technology works to help deliver health services to rural and remote areas. Nowadays, the growing use of video conferencing is enabling patients to access specialist consultations without the delay, disruption and expense caused by the need to travel. For those living in regional, rural and remote Australia, these video consultations are now covered by Medicare and so are widely available to more people. In this documentary, you'll hear from specialists and primary healthcare teams how telehealth is helping them to deliver the care their patients need when it's needed, and how it's strengthening their teamwork and care coordination. You'll also hear from the patients themselves about the positive impact telehealth is having on them, their families and their communities. The Diabetes Centre at the Cairns Base Hospital runs telehealth consultations across far north Queensland, Cape York and the Torres Strait. They've successfully developed a multidisciplinary team approach, and they also use the video conferencing technology for regular team discussions and training.
My name is Ashim Sinha. I'm the Director of Diabetes and Endocrinology at the Cairns Base Hospital, and I've been in this position since 2005. Since about 1999, we have been doing very intensive outreach work in far north Queensland, which includes the Cape District, the Torres Health District Service, and of course the outreach communities within the Cairns Health Service District, which includes Hopewell, Budgell, Atherton. When we started initially, of course, we didn't have the MBS item numbers. We applied for a project grant, and that project grant essentially gave us a person now to coordinate the entire telehealth program.
My name's Debbie Dean. I'm the telehealth coordinator here at the Cairns Diabetes Centre. At the Diabetes Centre here, we already offer a multidisciplinary team approach, and we offer services via email and telephone, as well as coming here to the centre. So telehealth just provides such a wonderful opportunity to engage with patients on a completely different level. We provide clinical consultations one-on-one, which means that team are down here in the Diabetes Centre, and the patient and their family and their carers and whoever else they wish to be there is up at Arakoon or the Cape or TI or whatever.
From a primary care perspective, and as how chronic disease should be managed more in primary care, the specialist only plays a secondary role, an important role, but a secondary role. And so unless the team care approach is there, we are never going to succeed.
The good thing about telehealth consultations is the fact that we can bring in the whole team as and when they're needed. We encourage the patients to sit there with their family and their carers, and also the team that are looking after them up there, because they're the people that normally end up delivering the care that's been discussed during the consultation.
At this centre, we have two Aboriginal and Torres Strait Islander health workers. Virginia Coods belongs to an Aboriginal community, and Gina Davis is from the Torres Strait. So we've got both communities.
My role is to be present with the telehealth consultations with the GP, our specialist, as well as a clinical nurse, telehealth nurse, and my role is to play an important part as well for the family member on the other side of the video conference, so they feel a bit more comfortable and are able to get the right information from the specialist while they're in their home communities.
The only other alternative prior to these was for these patients to come and see us, and that would involve a lot of inconvenience to the patient. The Torres Bridge also has enabled us to link in with any other doctor that wants to link from the outer islands. For example, we have Dr. Samuel Jones now in Badu, who links up from Badu, or the doctors from Bamaga or York Island.
Well, afternoon, Asha. As you know from the referral, I've referred through this 56-year-old lady to Manaruban for some advice really regarding her diabetes control and perhaps the next medication we could consider. My name's Dr. Sam Jones, and I'm a GP and Senior Medical Officer here on Badu Island. The telehealth service has really been a It's been a great initiative particularly over the last year. Here on Bardu, I'd say that now obviously everybody has access to specialist care through telehealth. And whereas before, particularly for the elderly or infirm, for whom travelling down to Cairns was quite arduous, telehealth has really made all these services much more widely available to everybody in the community. From my perspective, I see that telehealth is really going to improve the coordination of care, to bring about hopefully a really true shared care that puts the patient at the centre of the service provision.
We deliver professional development also via Link, which means that we have to date had as many as 17 different sites linking in at the same time and over 84 participants. This was for professional development, and these were nurses and health workers and doctors all at the same time.
The training aspect of it is really important. It connects us, it keeps us up to date, and also I think it also helps to connect people from the urban centres with here on Bardu.
I think the best thing about telehealth is the way that you can engage the patients so fully. They can have their whole family there. We can link in professionals and other specialists as needed, and it just becomes a very embracing, very engaging process.
In a community-wide context, it's very important that people understand that this technology is available, it's nothing to fear. I think it's very important to have an Indigenous health worker here at this end with the patient. I think that's very, very important.
We're now maximising our billing process using all the Medicare item numbers that have been given for this, so it is generating good income for the centre.
I think it's a really exciting advance in remote and rural health.
It's a very effective way of communication as long as all the parties feel comfortable to do it.
The New South Wales South Coast Medicare Local has taken telehealth to heart, employing a project coordinator to support and help those GP practices wishing to get started. They work with local general practice leaders to help spread the word.
My name is David Jeffrey, and my role is the Senior Planning Officer Telehealth for Southern New South Wales Medicare Local. The Commonwealth Department of Health and Ageing recognised that access for rural and remote communities to specialists was increasingly difficult, and so they've developed the Telehealth initiative in July 2011. So my role at times is working with the general practices that actually have started telehealth. It's about looking at what software they've got on their computer, whether it's a Windows-based computer or an Apple computer, and then installing the appropriate product. My role covers the entire region within Southern New South Wales Medicare Local, from Goulburn up in the north and western corner down to communities such as Eden right down the far south coast. I've recently held a very successful telehealth event within Canberra with specialists and Dr. Jenny Ray, an early adopter of telehealth, and she certainly is a pioneer in terms of our region as well.
I'm Jenny Ray, GP, Narooma and Bermagui. I've been in Narooma for 35 years, nearly 36. We opened a practice at Bermagui just before Christmas last year because Bermagui was actually very light on medical services. And it's been really quite a wonderful thing to have done. And although it's not a remote town, a lot of the people who live here are really quite poor, so that for them to actually be able to access any other services is actually very difficult. So when Dr. Mark D'Souza approached us through just a group email or fax, I can't remember now, it was just a comment to say, I just want to let you know that I'm actually available for telehealth consults.
How does that feel? My name is Mark D'Souza. I'm a general paediatrician. I am based in Nowra in the Shoalhaven district. I do clinics as well in Ulladulla, Batemans Bay, Bega and Pambula. So in that role, I provide a service that extends from Nowra down to the Victorian border. Telehealth makes absolutely total sense for my practice for those distant patients. So in terms of these consultations with the MBS items, I've been doing them since the start of this year. And because I am able to do it from my desktop, from my desk, really it fits in just like a normal consultation and with exactly the same quality of service for the simple questions.
I'm Frances Todd and I'm from Bermagui. This is my daughter Sarah. With Sarah and my younger daughter, they need to see the paediatrician. And so when we were visiting Jenny Ray to discuss their health issues, she suggested the teleconference so that we didn't have to make the trips to the paediatrician. To pull them out of school and go to Bega, that's a full day wasted. So she suggested, let's do this teleconference here at Bermagui where we can link up and talk to the doctor direct, and anything that we don't understand in medical terms, Jenny's with us in the room, and we can also ask Mark questions.
The impact of telehealth consults on the health of our patients has been enormous. It has meant that they get much less fatigued. But in addition, I think that they've actually quite enjoyed the three-way consultation, having the GP there as their advocate and talking to the specialist at the same time.
So it's improved not only access to patients, shorter waiting times, but it's also improved day-to-day communication.
Telehealth is actually becoming part of our normal clinical practice, and I think that we're limited only at the moment by the numbers of specialists we can access. So the more specialists we can access, the more of this we're actually doing. There are government incentives through the MBS, which I think certainly make it worthwhile to give it a go. I think it's just wonderful for the patients because they can access services which previously they've not been able to.
In my practice, I think that it has been a major enhancement, and if you have not been using it as a doctor or as a patient, I would only encourage you to think about how it might help you, and I think you'll be surprised at how useful it is.
Pinaroo is a farming community in South Australia, 230 kilometres from Adelaide. Telehealth is helping the local nurse-run hospital access immediate support for acute and emergency cases, and helping many patients in the surrounding rural communities stay in their own home and carry on working whilst getting the quality and timely care they need.
My name's Di Thornton. I have been working at Pinaroo Hospital for the last 14 years. It's an acute hospital with 8 acute beds, and it's got 23 aged care beds, and we run a 24-hour accident emergency as well. We're 230 k's from Adelaide, and our nearest referral centre is 180 kilometres away at Murray Bridge. Farmers have mental health issues and depression and anxiety, just like you and I do and other people in the community, so they need access. The last thing a farmer can do at this point in time is take a day off to get in his car and drive to Adelaide, wait for the specialist first up, have the appointment, then drive home. Whereas if all they've got to do is, come 10 minutes up the road or 5 minutes from their house to here and walk straight out of their car, 10 metres into the video conference room, it's sweet.
E-health, in my opinion, and certainly video conferencing, has an enormous capacity to enable small communities to remain viable from a healthcare perspective. A lot of rural remote people are very passionate about what they do in their rural remote communities, but also deserve access and equity to high levels, to high level care, which shouldn't be dependent on the postcode or where they live.
Living out on a rural area, I have felt that it's been extremely difficult. I've spent days and days early on the phone to basically all the neighbouring towns and the larger towns sort of heading out to clinics just saying, I have a sick partner and I need to get him somewhere, what do I do?
We sort of rang up, looking for specialists, and they said, oh look, you've got a 3 to 6 month wait or a 12-month wait, and we sort of thought, well, that's not really much good. And yeah, that was when Ken originally first thought this. He said, well, do you mind doing a teleconference? And, when you sort of look at a 12-month waiting list and you're at rock bottom, you can't really wait that long. So, we sort of did the conference, and look, I've only gone a lot further ahead since then.
We came into our local hospital here and used the Telelink, and he just sat there for well over an hour, and he went in broken and came out with hope.
the biggest difficulties that mental health clients face is being taken out of their own environment. One of the things that is very dear to them is staying close to home and around things and people that are familiar.
4 young kids, the last thing they want to see is their dad in hospital, and especially for a long period of time. So yeah, to them, I could come here, which is only 20 minutes away from where we live. They get to see me at night still, so you can come in for a consult, go home, and it's like, to them, there's no disturbance whatsoever to their lives, and which, can be a big thing, really.
I think most specialists just want to be able to provide high quality evidence-based services to people no matter where they live, and to do that effectively in rural remote communities, we've now got telehealth and item numbers to support practice.
I'm Brian McKenny. I'm the Acting Clinical Director of Rural and Remote Mental Health in Adelaide. The numbers of patients, particularly psychiatry patients who you might think would react quite poorly to this, either by being paranoid or overly anxious or generally uncooperative, is remarkably few. And I've been doing this for over 10 years and many hundreds of consultations.
Telemed conferencing is a very useful way of getting in touch with a psychiatrist without having to travel by air or car down to Adelaide.
I've been seeing Michael for about 5 years as his psychiatrist. He has previously had admissions to hospital. In recent years we've been able to avoid him coming to hospital through intervening fairly regularly with telehealth consultations.
Those long trips to Adelaide can be a nightmare, whereas if I have I know that in an hour's time I see my psychiatrist at Telemed, I can talk to him or her and get reassurance and some skills to deal with that particular problem.
Mental health clients who are really ill with depression or anxiety struggle with going out. So getting them, all they have to do is just go into a private room that's close to their home, and they know that they've got the sanctuary of their home to go back to as soon as this is over. It's much easier to get mental health clients to comply. I think the biggest surprise for me would have to have been the take-up of the clients. All the feedback that I'm getting from people after they've used it the first time is, this is so easy, why weren't we doing it before?
Seeing someone face to face is good, but you don't really notice much difference in a way. I mean, Ken's, you're on a big screen in telly and you can hear everything, and I had no challenges or no regrets, and I'd recommend it to anyone.
So from the word go, it was a very positive experience for us. It was sort of what we needed in the nick of time.
It gives us access, and it saves the community the travelling that they need to do. It's a safe way of doing things.
From every point of view, the Telemed is certainly the way to go.
Yeah, can't really speak highly enough of it.
Mount Isa in northwest Queensland is one of the regions connected to Townsville via Telehealth. Without these links, patients have to travel, sometimes for days, to see the specialist.
So I'm Dr. Sabason. I'm a medical oncologist and the Director of Medical Oncology at the Townsville Cancer Centre of the Townsville Hospital, and also a Clinical Dean of the Townsville Clinical School of the James Cook University School of Medicine. And I look after all the rural and remote patients in our Townsville and Mount Isa Health Service districts, along with my 3 other medical oncology colleagues in this centre. In our tele-oncology network, we have telemedicine facilities in all the small towns. So if it is about consultations, they don't need to leave their hometowns. That includes Mornington Island and all the remote indigenous towns. But if they need chemotherapy, obviously they have to travel to Townsville or Mount Isa. But if it is oral chemotherapy, a lot of the time they don't even need to travel to Mount Isa or Townsville, because we see them and then we send them the scripts. And then we follow them up, and all managed on video link.
So Sabe, we're going to treat Steve as an outpatient. Are you happy with that?
Yeah, I'm happy with that. And
My name's Sonia Bisson. I'm the Cancer Care Coordinator / Clinical Nurse Consultant for Oncology at Mount Isa Base Hospital and District. Telehealth has been very significant in increasing our services in remote areas because we can have a consult with the doctor and other treating specialists on screen, and they can advise us what to do if there's any changes in treatment, any new treatments. Right there, just like they're in the room, and we can then go and deliver that care after the video conference.
My wife Helen, I'm Steve. We've been in Mount Isa 20 years next year, and recently I've been diagnosed with cancer. I've got SCC, squamous cell carcinoma, which gets into your lymph glands. So basically it's an untreated skin cancer. It's got into my system, and now it's very difficult to treat. So we travelled a couple of times to Townsville with an initial consultation and then the treatment plan. With the video links now, we're going through the process of determining what the next course of medication is. I don't need to travel, so we don't need all that accommodation and the travels and the hire cars and whatever else is required when you're living away from home.
Because Mount Isa is 900 odd kilometres away from Townsville, it's often very difficult for the patients to actually make the trip for face-to-face consultations, and so telemedicine or telehealth, it's had a great uptake, and it's a really valuable service, I think, that the team in Townsville provide the residents here in Mount Isa and surrounding areas.
Once patients have their first session, they're usually very relaxed and easygoing about the whole procedure.
And then you just start talking. It's just so natural. It's really easygoing, and then when it's all finished, you know, you've sort of got dates set for whatever's going to happen next.
it's the same as face-to-face. The only different thing is there's a screen involved. So in the providing end, that is in my end, it could be me, it could be my registrars, and then at the remote end, we'll have the patient, the family members, and sometime it's extended family members up to 10, 12, especially from indigenous communities.
I'm been caring for my mother, who's been diagnosed with cancer for the last, I've been caring for her for the last 6 years. The big benefit of the telehealth has been really decreasing the stress that comes with caring for a family member in terms of living in a real town for one and having to go back and forth to a regional hospital for therapy.
So it's very, very beneficial to reassure the patient that they can probably stay here for their treatment, have their consult over video, reassure them that their family members can attend the video conference with them, they can attend the treatment sessions with them, they don't have to be taken away from family and loved ones.
We'll have conversations about local arrangements and the local team supporting access to medication or other palliative care arrangements that are out there, like home care.
It's an important learning experience, I think, from our perspective, to hear what our specialist colleagues have to say about the diseases that the patients are presenting with. But yeah, we're here to really support the patient through the process.
They're happy to have other family members there during the telelink. It doesn't just have to be Steve by himself. You know, I'm always welcome to be there, and if my daughter wanted to come along, she could, you know, she'd be welcome to come along as well.
You know, if you've got family spread out across the state or the country or in different towns, it's a way to bring everybody together and to support the carer role that you might take up as a family member, and it really offers huge benefits to Aboriginal families, I think, and it supports the way that we do things, in that it does support family decision making.
I have no reservations using the Telelink system because the information, he's right there face to face. It's not like you're on a telephone. You can see him thinking and talking, and it's a good way to go, I think.
It's the way of the future, and it's the way we should be doing it for remote areas.
Yeah, I would really encourage other clinicians to give it a try.
Use it. Yeah.
Telehealth is going to become the way medicine is going to be practiced in the near future.
Saves a lot of time, a lot of effort, a lot of inconvenience and a lot of heartache.